How do ACE inhibitors work? What do they do? What are they prescribed? And what do you need to know to pass the NCLEX, HESI, your midterms, or finals? All of those things. We're going to talk about all of that, and then stick until the end, because we're going to also take everything that you learned in this video and we're going to apply it, and we're going to answer some Nclex-type questions. All of that and more coming up. Converting enzyme inhibitors, and these medications are typically given to patients to help control the blood pressure. But before we start talking about the medications, ACE inhibitors, or we start talking about even hypertension, first I want to talk about how the body is supposed to work in a healthy individual. You should never start learning the medications by themselves, because remember, the medications are the answer to a specific problem. So before you can understand what the medications do, first you have to understand what the problem is. And before you can understand what the problem is, first you have to understand how the body... So in a healthy individual, basically what's going on is that the body tries to constantly stay in a state called homeostasis, which means everything is working normally and the body is taking into account things that how things can change in your environment. So in this case, we're going to talk about hypertension later on. First, you have to understand how we get to that point. So in a healthy individual, basically what's happening is that there was a change in the environment. Let's say, for example, a person walks into a sauna where the temperature is really hot, or let's say, for example, maybe they were indoors in a nice cool environment, and then they walk outside where it might be 105 degrees or something like that. And so the bottom line is, in all of those things, the body is going to, or the blood vessels are gonna wanna vasodilate. That happens every time that there's a change in the temperature, where the temperature gets hotter, you vasodilate. Now there's other reasons why the arteries may vasodilate, but for purposes of this video, we're going to stick with those. So what happens is that there's a change in the environment and the arteries want to open up or vasodilate, so there's a drop in the blood pressure, and the blood pressure, amongst many other things, are constantly and continually being monitored by the human body. So when the blood pressure drops below a certain level, then a system is going to be activated that's going to help correct that issue, and is going to want to bring the blood pressure back to normal. And in this case, that system is the RAAS, the renin-angiotensin-aldosterone system. So basically what's going to happen is that when the blood pressure comes to a certain level, the kidneys are going to release something called renin. Renin is going to in turn go into the liver, and it's going to let the liver know, and the liver is going to produce something called angiotensinogen. Angiotensinogen 1 is going to be converted into angiotensin 2. Angiotensin 1 is a weak vasoconstrictor, so it's going to act upon the arteries and the cells and the specialized cells within the arteries to want to vasoconstrict. Now, it's a weak vasoconstrictor. If that doesn't get the blood pressure to where it should be, then through an enzyme, angiotensin 1 is going to be converted to angiotensin 2. And angiotensin 2 is a more powerful vasoconstrictor, and that is going to allow the blood pressure to come back up. In addition, angiotensin 2 is going to suppress aldosterone production. When we suppress aldosterone, the aldosterone mechanism, several things are going to happen, and you should know them. The first one is that because we are suppressing aldosterone, now we're going to let go of more sodium and more water, and we're going to keep potassium. That is the reason why in ACE inhibitors, one of the side effects is hyperkalemia, because we are holding on to that potassium, okay? So in a healthy individual, that's what's going to happen. The RAAS system is going to be activated, and that's how the blood pressure is going to come back to homeostasis. Once the blood pressure is back to normal where it should be, then that system is slowed down and suppressed so that the blood pressure won't go up too much. In a healthy individual, that's how it's supposed to work. Now, so what happens in hypertension? So in hypertension, that system is broken. And now, regardless of where the blood pressure is, that system is initiated or it's maintained, giving the person high blood pressure. So that's where we start talking about ACE inhibitors. An ACE inhibitor is a medication that's going to target that enzyme that makes angiotensin 1 be converted to angiotensin 2. And it's going to inhibit, or it's going to stop that enzyme, so we never get to angiotensin 2. Therefore, that's how we control the blood pressure. So that is what ACE inhibitors do. Now, let's talk about some of the side effects of ACE inhibitors. The main one, or the most life-threatening one, could be angioedema. So a patient that is newly placed on ACE inhibitors, we really have to educate them on a side effect called angioedema, which is inflammation of the facial structures, of the smooth muscles of the facial structures. And if angioedema is moderate to severe, this could potentially turn into a life-threatening emergency, because in some cases the patient's ability to breathe can be impaired, and this is definitely an emergency situation. They have to go to the ER immediately. Some patients, it could be a very mild side effect. You definitely want to let the prescriber know, whether it's a doctor, a nurse practitioner, or a physician's assistant. You want to let them know regardless of the severity, so that they are aware, and that we can make decisions based on the severity and how the patient's going to tolerate it. Another side effect of ACE inhibitors could be hyperkalemia. So in hyperkalemia, the potassium is going to be elevated, and of course you may already know the first organ that we are concerned about with hyperkalemia is going to be the heart. The patient is not going to come and tell you, hey, I think I have hyperkalemia, go ahead and check my potassium. They normally will not come in and say that. Normally what they're going to present is they're going to say, you know what, I started this medication and now I have palpitations, now my heart feels funny, I get tired really fast, things of that nature. So when you do your assessment and you are reviewing their medications and you come across an ACE inhibitor, you will know that those symptoms could possibly be associated with this medication. Other side effects can include a change in the patient's renal function. There may be a little bit of a decrease in the function of the kidneys once the patients are started on ACE inhibitors. We expect a little bit of a change, but not too much. So of course, it would always be a good practice to get a set of lab work and vital signs prior to the patient starting these medications, and then we can follow them through as they start taking them, because as I said before, they can have any of these potential side effects, including a decrease in their renal function. So we of course want to make sure that we follow their creatinine and their GFR closely to make sure that the medication doesn't disrupt that too much. And of course, it may be, this is depending on the prescriber, this may bar a patient from being placed on ACE inhibitors if they already have a poor kidney function to begin with. So that's definitely something that you want to keep in mind. So what is going to be some patient education that you are going to provide for your patients, whether they're going to be placed on these medications in the future or whether they're on them now? What should you tell them? And this is really where you really need to understand, because the Nclex, HESI, they are big on these type of questions, and on this specific area, the Nclex and the HESI, they don't just want you to know how the medication works and how the body works. They're also going to want to test you on what are you going to tell the patients, how are you going to educate them so that you can be practicing safe nursing. So the first one, of course, is whenever possible to try to prevent the problem in the first place. We already know that sodium and high sodium intake can contribute to high blood pressure. So we're going to educate them on a healthy diet, which includes a low sodium intake. the other thing that we can educate them on is on stress management. Sometimes patients have a healthy diet, they have a healthy lifestyle, but they overstress or they stress too much, and it's been proven that stress can increase the blood pressure. So definitely stress. Another patient education point that is very important is on medication compliance. Patients should be taking this medication as directed by the prescriber. One thing is that another side effect that this medication may have is a dry, hacky cough, and sometimes that will make the patient want to stop taking the medication abruptly. So you want to educate them not to do that, and instead to call the provider, or to let the provider know in anticipation, so that we can probably talk about other alternatives to this medication, and it will enhance the patient's compliance with the medication. And lastly, the last one that I want to talk about is overall a healthy lifestyle. So we incorporate all these things together, and it includes a healthy diet, a low sodium diet, adequate exercise as a patient can tolerate, of course, and a healthy stress management or coping strategies for stress. So now that you have all the knowledge about how ACE inhibitors work, let's go ahead now and try to apply that knowledge and answer a couple of Nclex-type questions. Let's go. Okay, question 1. Your patient is taking an ACE inhibitor to manage blood pressure. Which finding below would require immediate nursing action? A. Urinary output. Okay, question 1. Your patient is taking an ACE inhibitor to manage blood pressure. Which finding below requires immediate nursing action? A. Urinary output is 190 mL within the past 4 hours. B. Patient has a persistent dry cough. C. EKG shows tall, peaked T waves. And D. Patient has a negative Chvostek sign. So what do you think? We have to break down this question. The actual question is which finding below requires immediate nursing action? This is a question of prioritization, and which one of all these is an emergent situation? Well, we can start off by eliminating the ones that are not specific to ACE inhibitors. D, a Chvostek sign, that is more for patients with hyponatremia. So we can eliminate D right off the bat. A, urinary output is 190 mL within the past 4 hours. Although we did talk about ACE inhibitors affecting urine output, this output is not emergent at this point. So we can eliminate A. So the only remaining answers are B and C. Patient has a persistent dry cough, and C, EKG shows tall peak T waves. Well, B is correct because patient has a persistent dry cough, but it is not the correct answer because it is not emergent. Remember, the question is asking which action requires immediate nursing action. EKG shows tall peak T waves. This is indicative of a patient with hyperkalemia, and an EKG would show tall peak waves. So this would be an emergent situation. Therefore, the correct answer is C. The next question. Some patients who take ACE inhibitors may develop angioedema. What signs and symptoms will you teach the patient to recognize that can present with this adverse reaction? Select all that apply. A, hyperkalemia. B, persistent dry cough. C, thin and shiny skin in the lower extremities. Or D, difficulty breathing. So the specific question is, what signs or symptoms will you teach the patient to recognize that can present with adverse reactions related to angioedema? Well, hyperkalemia is not really related to angioedema. It's related to ACE inhibitors, but not to angioedema. Persistent dry cough is also related to ACE inhibitors, but it is not related specifically to what the question is asking of angioedema. C, thin and shiny skin in the lower extremities. We can see thin and shiny skin secondary to the inflammation that happens in angioedema. So C would be a correct answer. And D, difficulty breathing. Difficulty breathing is also one of the hallmarks of angioedema. Therefore, C and D would be the correct answers. So this is how you navigate through the questions, whether it's NCLEX, HESI, finals, or midterms. This is how you want to navigate through the questions. If you got any value out of this video, make sure to hit the like button, make sure you subscribe so you can be notified of all the videos that we put out. And also make sure in the comment section that you let me know any more ideas for videos that you may have, any particular topic that you're struggling with. Let me know down in the comments, and I will make sure to follow up with a video to help you get through, whether it's nursing school, whether to get through any exam, whether it's the NCLEX, the HESI, whether it's midterms, finals, or whether maybe you're just struggling with a particular subject matter and you just want to grow your knowledge in that particular area. So make sure you let me know down in the comments below what topics you may have or where you are struggling, and then we'll follow up with the video. I'm glad that this video was able to help you, and we will see you next time. Thank you.